Greetings from Guwahati. All of you are aware that we are facing through an unprecedented pandemic due to COVID-19. COVID-19 has brought the whole world to practically a standstill position. We, the health professionals, and our colleagues, the other health workers, are in the forefront as barriers of COVID-19 and fighting this pandemic very boldly to contain it and to serve our humanity. They are doing a tremendous work which is laudable. Now, doctors, irrespective of the specialities, have become one, and there is only one motive to fight COVID-19. As a result of which, we have to reschedule our regular OPDs, admissions, and we, especially the urologists, like other specialists, are handling only emergency situations. As a urologist, we are concentrating on the cases of stone disease which are coming with anuria, where immediate attention is required. Those cases of clot retention, where immediate clot evacuation is mandatory. Torsion testis, where a delay is not at all possible. Cases of penile fracture, and those cases of unstable genitourinary trauma. Regarding urological cancers, too, we have to reschedule the cancers which can wait for some time, or we can postpone for a month or two. But those malignancies which need immediate attention, like muscle invasive bladder cancer, clinically stage 3 plus renal malignancy with renal vein or IVC thrombosis, cases of testicular malignancy, those on chemotherapy, etc., and even high-grade upper tract urothelial malignancies are tackled immediately, because in these situations, postponement or rescheduling is very dangerous. Now, as a urologist, there are certain cases of recurrent urinary tract infections wherein we have to reschedule them in order to decrease the number of clinic visits. To them, I have to say that you have to modify your lifestyle, like drinking adequate fluids to the tune of 12 to 15 glasses a day, have green leafy vegetable, good amount of fruits, don't postpone the voiding, because this will be very derogatory for the urinary tract infection. And one more thing I have to say, that we have to do some meditation, your yoga. You have to take out some time, for example 30 to 45 minutes a day, because this has got positive effects in the times of pandemic. Now the question is, how long we will reschedule our regular duties? In my opinion, it is not at all possible to reschedule everything for a pretty long time. We have to, the virus is there to stay for some time, and we have to live with the virus till a herd immunity or an appropriate vaccine is available in the market. So now already already 2 months have gone. India is in lockdown like other parts of the world. Even though the cases are increasing sharply in India, we cannot go on a lockdown situation for a pretty long time. So we have to go with the routine work with certain modifications. For example, in a regular OPD setting, at the registration counter, so it should be somebody to take a proper history for fever, flu-like symptoms, recent history of travel, and in history of any contact with a suspected or COVID patients. If any of these things are there, then they should be sent to a fever clinic or a screening center. Then there should be thermal screening of all patients who are attending the OPDs. And in the waiting area, there should be adequate distancing, at least 1.5 meters in the waiting area where the patients are sitting. Then limiting the number of attendants. Attendance should be permitted only wherever it is absolutely necessary. As a doctor in the chamber should be quite spacious. There should be a distance of approximately 2 meters between the patient chair and where the doctor is sitting. The doctor should wear cap, goggles, 3-ply surgical mask, face shield and surgical gloves. There should be facility for hand sanitation. Patient, when he comes into the doctor's chamber, should wear mask and he should be asked to sanitize his hand. And in case of regular OT, we have to do with the elective cases, and in the wards, those cases who are admitted, there should be 6 feet distance between each beds. All the patients in the indoor should be asked to wear mask, and there should be facilities for hand sanitization, and they should be taught proper cough etiquette. And regarding the attendance should be strictly limited in the indoors. Wherever it is absolutely necessary, only attendance should be permitted. And apart from all the routine investigations, COVID-19 tests should be done in all the patients who are posted for elective surgery as well. And in the OT also, OT should be properly sanitized, and there should all limited OT personnel should be available. That is, the minimum required staff only should be present in the OT. All the surgeon and the OT staff and the anesthetist should wear cap, goggles, 3-ply mask, face shield, then nitrile gloves, boots, shoe cover, and the gown, which I say but the same gown which we use for HIV cases or hepatitis C, or when you do a case which is Australian antigen positive, is sufficient enough. And we should maintain all precautions while doing the surgery. Especially we as a urologist, we deal maximum number of endourological cases. And there should be proper sanitization of the OT room after a case is over, and a minimum period of 30 to 45 minutes interval should be there between the cases. So with these precautions, we have to go forward with our routine OPDs and routine surgical procedures. Otherwise, delaying everything is not the answer, because we have already rescheduled our cases for the 2 months, and we cannot further reschedule each and every case which requires surgery. With this, I will say to my colleagues, urologists, that we should take our own precaution and social distancing, and we should do our routine work without any fear, and this will go on for some time till we have a herd immunity or appropriate vaccine is available. With this, I conclude with an advice: take self-care, all precautions, and remain safe and healthy. Thank you.